Good day. We are the group 4 and we will be discussing about respiratory drugs. Content outline. The first one is the antihistamines, antitussives, bronchodilators, decongestants, expectorants, mucolytics, and TB meds antitubercular.
Our first respiratory medication is antihistamines. Antihistamines is used to stop allergy reactions or allergy symptoms from allergens such as pollens and seafoods. And antihistamine medications is used to relieve runny nose, sneezing, itchy or watery eyes, and nose or throat itching. We have here three example medications for antihistamines, which are chlorpheniramine, as its generic name, and its brand name is called Olorflor. Dimeclozine, and its brand name is Antivert, and lastly, the cetirizine, and its brand name is called Zyrtec. The mechanism of action of antihistamines is to selectively block the effects of histamine at the H1 receptor. This histamine is a chemical release during inflammation, which it narrows the airways and increases secretions of mucus. So antihistamines should be taken only if the client or you have been exposed or have eaten something you're allergic to for the drug to take effect. Its major adverse effects on the central nervous system is sedation ranging from mild drowsiness to deep sleep. And prolonged use to antihistamines may result in local irritation and allergic contact dermatitis. This local irritation or allergic contact dermatitis may be found in the skin. So now I am going to proceed to nursing actions, consideration, and its rationale. So first, we have here the document vital signs I and O, CV status, lung sound status, and characteristics of secretion. So the rationale is to establish baseline data to be used in assessing the drug's effectivity and to be aware of the side effects associated with the drug therapy. So next is take before or at the onset of symptoms cannot reverse reactions but may prevent them. Oral products may cause gastric irritation. Administer with meals, milk, or snack. Antihistamines prevent symptoms, so it only works when symptoms persist. Taking oral product with food is advised to prevent gastrointestinal discomfort. So number 3, do not drive or operate equipment until drug effects of drowsiness wears off. Sedative effects may disappear after several days or may not occur at all. So the rationale behind that is to reduce the risk and prevent injury. So number 4, report sore throat, fever, unexpected bruising, bleeding, or petechiae may cause blood dyscarcia. So of course, this should be reported because we all know that this is life-threatening. So hematologic reactions are said to be rare, and that includes anemia or breakdown of red blood cells, reduced platelets, reduced white cells, and bone marrow failure. So next is number 5 may cause sensitivity to sun or ultraviolet light. Avoid long exposure. Use sunscreen, sunglasses, and protective clothing when exposed. So some antihistamines medications may cause photosensitivity, exposure to sun, or UV light that can cause the skin to form rashes and blisters. So next is severe central nervous system depression is a symptom of overdose. Report dizziness or weakness and avoid other CNS depressants. So the rationale is Dry mouth is one of the side effects of antihistamine. It is important to moisten, increase saliva production, and have a good oral hygiene to prevent from infections or mouth disease. So number 7, reduce symptoms of dry mouth by frequent rinsing, good oral hygiene, and sugarless gum or candies. So the rationale is to decrease the problem of thickened mucus secretions and dry nasal mucosa. Milk can severe these symptoms. Voiding prior to taking the drug can prevent urinary retention. So the last one is number 8. Ensure adequate hydration. If bronchial secretions are thick, increase fluid to decrease secretions viscosity. Avoid milk temporarily. If problem with urination, void prior to taking the drug. So the rationale behind this is antihistamine releases a chemical during inflammation which narrows the airways and increases secretions of mucus. Therefore, it can cause dehydration, so drinking lots of water is needed. So if you're wondering why milk needs to be avoided, it is because there's a tendency that milk can severe the symptoms. Drug classification is antitussive. Generic name is dextromethorphan guaifenesin. Brand name is Robitussin DM. And its mechanism of action is dextromethorphan acts on the cough center in the medulla to raise the threshold for coughing by decreasing the excitability of the cough center. Guaifenesin, on the other hand, loosens and thins phlegm and bronchial secretion to ease expectoration. Major adverse effects is dizziness for sedation, headache, constipation, and drowsiness. Nursing action or consideration. First is assess type and frequency of cough present, and its rationale is to accurately give the right medication and dosage to the patient. Second is assess if the cough is interrupting rest and sleep, to assess if the cough is getting better or worse. The third one is instruct the client to take the medication only as prescribed and not to increase the dose without consulting the physician. Its rationale is to avoid overdosing a patient. The fourth one is teach the client that drowsiness may occur, so driving or performing any task that requires full level of alertness should be avoided. Its rationale is to inform the patient that drowsiness is a normal side effect of the medication for her or him to avoid any accident. The fifth one is to note that the medication may be used in conjunction with a vaporizer in the evening to make the patient feel more better. And the last one is instruct the client that if coughing persists after 5 to 7 days to return to physician to inform the client to avoid worst case. Bronchodilators. Albuterol sulfate. Generic name albuterol. Brand name Proventil HFA. Mechanism of action is relaxes bronchial, uterine, and vascular smooth muscle by stimulating beta-2 receptors.
And it blocks the release of allergic from mast cells lining the respiratory tract.
Alright, so the next one is I will be discussing about the adverse effects of bronchodilators. First is trembling, particularly in the hands. And then you'll also experience headaches, a dry mouth, suddenly noticeable heartbeats or what we call palpitations, muscle cramps, coughing, nausea, and vomiting. The next one are the nursing responsibilities that every nurse must
consider. First is that bronchodilators may aggravate diabetes because they cause hyperglycemia. It has shown in the studies that beta-2 agonism causes glycogenolysis and gluconeogenesis that raises glucose levels, especially in large doses. Second is that patients with known hypertension should be monitored closely when given bronchodilators, especially administering intravenous bronchodilators, because this can increase blood pressure, and that's why it should be used cautiously in patients with hypertension. Next, bronchodilators should be used cautiously in patients with hyperthyroidism and those receiving cardiac glycosides, because asthma can be aggravated by hyperthyroidism, as well as tremor, nervousness, tachycardia, large heart pressure, palpitations, emotional inability, anxiety, nightmares, violent behavior, and so many signs of hyperthyroidism that are similar to the adverse effects of the widely used inhaled bronchodilators, because the cardiac effects are also additive. Lastly is excessive use of bronchodilators inhaler may cause tolerance and paradoxical bronchospasm. So tolerance implies that with regular or high-dose usage, the response to supplementary short-acting beta-agonist use may be blunted or absent. And the reason behind paradoxical bronchospasm is because with B2 agonist containing inhaler formulations, this phenomenon has been observed and is an adverse occurrence that is still under-recognized. Decongestants. Here are 3 medications of generic names with their corresponding brand names. First, pseudoephedrine or Sudafed, guaifenesin or pseudoephedrine or Deconsul-2, guaifenesin phenylpropanolamine Duravant. The mechanism of action is that it activates alpha-adrenergic receptors in which the dilated arterioles are constricted within the nasal mucosa. By means of this, it would result to minimizing the amount of swelling and mucus buildup, thus allowing less obstruction in the respiratory tract. What are their adverse effects? Rapid heart rate, elevation in blood pressure, restlessness, and appetite loss or reduction may be a problem. Lastly, what is the nursing action? Be aware that the nasal sprays often have rebound effect. The client should understand the serious nature of a rebound and know not to use nasal decongestants unless absolutely necessary. Using nasal decongestant sprays frequently may lead to less response to the effects of the medication that would result to using more and more doses to manage blocked nose. The patient should understand the extent of rebound effect and use the drug when needed, for it may cause a habit-forming substance that can be harmful and lead to addiction.
Next is the expectorants. Generic names and its brand names: guaifenesin, Mucinex, Robitussin chest congestion, Robafen. Potassium iodide, Pima syrup, guaifenesin, Mucinex, maximum strength. The mechanism of actions of expectorants. It performs by sending signals to the body to raise the volume or hydration of secretions, contributing in even clearer secretions, and also as a byproduct lubricating the agitated respiratory tract. The adverse effects are excess salivation, fatigue, gastrointestinal effects such as acid reflux, diarrhea, nausea, vomiting, and stomach pain. The nursing actions. First is to encourage the client to take fluids liberally. And the rationale: fluids are essential for our cells, organs, and body systems to work properly. It has compounds that help the body to do much of its work, producing energy and contracting the muscles. The second one is to instruct the client to avoid smoking and being near cigarette smoke. It is to eliminate smoking in all homes, work sites, and public places, and also a way to protect non-smokers. And it will greatly lower your risk of death from lung cancer and other diseases. Have the client call the physician if the cough persists for 5 to 7 days after treatment is initiated. It is indeed better to see a doctor with coughs that last more than 5 to 7 days since they may signify something much more severe. And the last one is to instruct the client to use other therapies such as vaporizer, humidifier, increased fluid intake, and adequate nutrition. It may help ease symptoms of a cold or other respiratory condition.
Mucolytics. It has three medications, which are acetylcysteine with the brand name acetylcysteine and mucomyst. Another is carbocysteine with brand names Actiol Mucolitico Infantil, Actiol Mucolitico Antihistamino, Aflem, Alivox, Amicof, and lastly, bromhexine with the brand name Bisolvon and bromhexine elixir. Its mechanism of action are dissolves thick mucus and relieves respiratory difficulties and reduces viscosity or bronchial secretion, thus making the secretions more easily be removed by cough. The major adverse effects of mucolytics are inflammation of the mouth, nausea, vomiting, fever, and runny nose. The nursing actions and its rationale are to treat fluid and electrolyte imbalance in order to prevent excessive amount of fluids in the body or dehydration, and do not administer diuretics in order to avoid combining other drugs and the potential loss and effectiveness of the medication.
So if mga tanang ka, sa din ang isoniazid. So, magbasa ako libro nga unsa na ang isoniazid. So, stated sa libro nga ang isoniazid is an antituberculosis agent that inhibits mycolic acid synthesis, which interferes the cell wall of the bacteria, thereby producing bactericidal effects. In simple terms, patyo no niya ang kagaw sa TB o magtabang sa pagpahunong sa pagpanagan sa mong kagaw. So, ang atong isoniazid has three brand names, and these are nardrazide, Rifater, and Rifamate. So, karon ikaw nurse, nagsugod na ka og treatment o administration sa imong patient. Karon, nagsugod na siya. Imo gid siya dapat i-monitor. Mao gini pinakauna. Kung nag-adhere ba siya sa treatment, iya ra bang gitarong og dawat ang ang pagtambal kay. For example, naamong ko'y tao nga magpadala pareha sa TB, taas kayo treatment kani nga sakit. Mao na dayon to yung silingan nga, grabe, 6 months imong papanambal. Pangorta ram na nila, kita ba ko kag sakit 6 months tambalan, cancer man na. Mutuod na yan, hanggang ang treatment. Niya pagbalik sa sa nurse, sir, dili ka pwede na. Ayan na po balik, pero wala good ang TB bacteria ni Kuska nagbalik. So, mao gina atong dapat i-prevent. So, ikaduha, serious side effects should be monitored as well pareha sa neurotoxicity, hematologic abnormalities, and systemic hypertensive reactions para ma-prevent ang mas grabe nga complications caused by other systemic damages. Pareha sa hypertension for an instance. Dili siya normally linked to TB. However, it's a side effect caused by the drug. Silbi dili TB ang lagi sa iyang high blood, kundi ang tambal itself. So what to do with this as a nurse? Pwede data maghatag og hypertensive medications by sa atong pasyente. Pero dili lang hypertension but to other light side effects. Ato sa diya tabangan na kay naman tayo light side effects nga pagkalipong or dizziness, kasukaon or nausea, ug daghan pang ubang epekto tungod sa tambal. So lastly, ang pag-educate sa imong pasyente. Kita, the nurse, should provide infos that should convince his or her patient to adhere to the treatment. Dapat tarungon niya yung pagpanambal kay, as I said, ganiha, mula ginadaga magpadala sa storya na pag-explain balik sa nurse. Ayaw na sa siya mo tuo. Kaya ang most common nga nadugay may eradicate ang TB bacteria, unstable commitment sa pagpatambal. Ato na lang timanan nga ang TB dali mabalik og kakusgan ug dali mabalik og panagahan. So everybody should follow the professional's advice. Nga ipadayon, continue the treatment ug i-follow nimo ang advice sa imong physician ug ang nurse. So, mura na about sa isoniazid. Sa day ng rifampin, tambal na siya sa tuberculosis, antituberculosis agent. So, unsa man nga way makatabang siya sa tuberculosis, makapaayo siya sa tuberculosis. So, stated, rifampin acts via the inhibition of DNA-dependent RNA polymerase, leading to suppression of RNA synthesis and cell death. Sa sayon nga pagpasabot, ang rifampin magpaginay, magpaluya, ug dayong pagpatay or eliminate sa maong kagaw. Aduna na tayo ka brand names sa rifampin, which are Rifadin and Ivermectin. So, ikaw nurse, during sa administration ng treatment, us nurses must have to do these following responsibilities. Now, the very first is to advise the patient to undergo periodic liver functioning test. Why? Rifampin is associated with hepatotoxicity due to the elevated aminotransferase and bilirubin levels. So, ang pagpanambal gamit di ay ang rifampin, posibleng maka-apekto sa atay sa pasyente mo, dapat mag-advise ang nurse na mag-undergo liver test sa pasyente. Because if not, who would? This is to prevent other systemic damages from put due to the drug. Ikaduha, regarding na sad ni sa non-adherence of the treatment, mao dyan na, pinaka-common, non-adherence, non-commitment. TB infection could always come back and could be active again, and you don't want that to happen. Di man na maingon ang kagaw, sumulan ng lawasa, balin na sa tiglahin, kay balik-balik na kayo siya diri. Remember, treatment interruptions can lead to poor treatment outcomes. So, nurses we are, it is our utmost responsibility to educate our patients about the complexity of the medical aspect. Let us be resilient patient advocates. Lastly, daghang pagkalibog sa itong pasyente throughout their treatment. Daghang sila how and why. And nurses we are, ato na sa ng job, ato na sa ng responsibility. And we should be gratefully answering it. Like sa light symptoms, dizziness, pagkalibog, ato sila pasabdol nga normal na sa tambal o ato sila tabangan in managing these symptoms para dili sila ma-discourage throughout their treatment. Unya padayon og hopeful ang ilang pagpanambal. So kato, maura, important key to remember, rifampin suppresses the bacteria and given the chance, the medication then proceeds to killing the bacteria. Unlike isoniazid, nga ang pinakaunang tambal nga mo dapat if na-TB, more on killing her siya. Rifampin suppresses the bacteria first and then aya ang elimination. Daghang salamat sa pagpaminaw.
So, another antituberculotic drug will be ethambutol or mayambutol for its generic name. So, the mechanism of action of this drug is it acts as a bacteriostatic that inhibits synthesis of one or more susceptible bacteria. So, when you say bacteriostatic, it is a chemical agent that stops bacteria from reproducing, or it can be stopping its growth. So, the susceptible bacteria for this is the Mycobacterium tuberculosis. So the major adverse effect of this drug is it can cause inflammation of the optic nerve. So we need to monitor patient's vision on a monthly basis. So the nursing management of this is to perform visual acuity and color discrimination tests before and during therapy, because ethambutol is the first-line treatment for tuberculosis, but the major adverse effect of this drug is optic neuritis. So we need to perform visual acuity in order for us to have a baseline of our patient's visual acuity And in order for us to assess if the patient is experiencing the major adverse effects. And next is we need to monitor patient's uric acid level, observe for signs and symptoms of gout. Because this drug can cause hyperuricemia by decreasing renal uric acid clearance and can lead to polyarthralgia. So, as we all know that the increase of uric acid level is called hyperuricemia, and when you have hyperuricemia, it can lead to gout and also to polyarthralgia. So polyarthralgia is an arthritic pain and aches in the joints, and this disease is common in women, more so with increasing age. So next is to tell patient to report if there is any vision changes immediately. So it is because changing of color or vision indicates adverse effects. So we need to encourage our patients to report to us if ever they're experiencing vision changes or color discrimination in order for us to take action immediately by stopping the patient of taking that medication and introduce them to another antituberculotic drug in order to reduce its toxicity. Next is stress importance of compliance with drug therapy. Why? Because the treatment of TB disease lasts longer and requires more drugs than treatment for other infectious diseases. In order for us to cure TB and prevent drug resistance, patients with tuberculosis must follow the recommended course of treatment. Discontinuation of usage of this drug may lead to growth of the bacteria again. So your efforts will be useless if ever you will stop the drug without the physician's permission or not finishing the course of treatment. Next is you need to advise patient to report adverse effects reactions to prescribers. So we need to encourage your patient to report it, to not be afraid to report it because reporting it helps your patient to protect himself from further harm caused by the drug, and also it can cause or it can help the prescribers from legal problems. Next is pyrazinamide. So the mechanism of action of this drug is it is also a bacteriostatic against Mycobacterium tuberculosis, but it depends on the concentration of drug attained at the site of infection. So actually, the mechanism of action of this pyrazinamide is unknown, but in vitro and in vivo, the drug is active only at a slightly acidic pH. So the major adverse effect of this pyrazinamide is it causes retention of urate. Urate is a uric acid salt, so this can cause gout or kidney stones or renal calculi. So the appropriate nursing management of this will be you need to ask your patient if he have drug resistance disease, because patient with drug resistance disease should be treated with regimens individualized with their situation in order for the drug to be effective. Next is you need to tell the patient to continue taking the drug even if symptoms again, as what I've mentioned in the previous drug or the previous nursing management, is stopping the medication too early
or skipping doses may allow the bacteria to continue to grow, which may result in the return of infection. So your efforts will be wasted and also your money. So you need to continue using this drug. You need to not loosen up your guards. The least is the betaquilin fumarate, or the brand name for this will be Serturo. So the mechanism of action of this drug is it inhibits mycobacterial tuberculosis synthase, or its structure is adenosine 5-triphosphate synthase. So the major adverse effect of this is it may cause cardiac arrest and sudden death due to prolonged QT. So prolonged QT, or QT prolongation, is the measure of delayed ventricular repolarization, which means that heart muscle takes longer than normal to recharge between beats. So this can be seen on ECG. The nursing management for this is you need to inform patient the drug will be given as part of DOT. So drug must be given by DOT because there is a risk of treatment of failure if patient is not compliant. And next is you need to advise your patient to take drug with food, to swallow tablet whole, and not to dissolve, crush, or chew it. Because for a number of reasons, some tablets shouldn't be crushed or chewed because doing so may result in dose dumping. Some tablets or pills don't work properly or may be harmful if they are crushed or bent, such as dose dumping, that can lead to overdose. And you also need to take this drug with food in order to reduce stomach irritation, and by taking food, it will reduce the effects of this. So next is you need to warn your patient to avoid alcohol and hepatotoxic drugs or herbal supplements, because antitubercular drugs are potentially hepatotoxic. So taking alcohol or any herbal medicines that are hepatotoxic can worsen your condition or can lead to any liver diseases. Next is you need to monitor potassium, calcium, and magnesium levels before the therapy and correct if abnormal, because these potassium, calcium, and magnesium should be maintained at baseline. And whenever clinically indicated, especially if QT-CF prolongation is detected, or corrected QT interval by Fredericia.